Good afternoon, Dr. Raynor. Welcome to the Thinking Physio podcast. It's my pleasure and privilege to have a chance to chat with you today. And thanks for taking some time off on your busy Saturday and on the weekend to chat with me here.
Not a problem, Abhijit. Thank you for inviting me. The pleasure is all mine. Anytime that people will listen to me speak, I'm humbled and I'm amazed that they want to hear me talk about stuff. So thank you for inviting me, and I'm happy to be here.
So my pleasure. Now, I was thinking, where do I begin? And I got to say, like, the way you introduce yourself or the way you introduced online, I think it's so apt. You're not an everyday ortho, and I totally agree to that. Like, you're not an everyday ortho who's doing just a 9 to 5. So I see you're doing so many things. You're up like at 5:30 a.m. in your car. I see your stories every day, and then you're out doing doing consultations. You're in the OR. You're seeing patients every day. You have your own business. So could you briefly give us a bit of a background about like all these different hats that you juggle, sir?
Yeah, so you touched on most of them there. So first and foremost, I'm a full-time orthopedic surgeon. So I have a specialty in sports medicine and arthroscopy. That's what I do primarily. But as you know, people who are listening may not know, not all surgeons work, affiliated with a university. So I'm what is known as a community orthopedic surgeon. I do have a university affiliation with the University of Ottawa, but I'm not what's known as an academic orthopedic surgeon. So I don't teach regularly at the university. I don't have medical students in residence regularly. And I don't do clinical research. Because of that, that means I'm an orthopedic surgeon in a community hospital. And so I run my own practice. I have my own secretary. I have my own office. I run my practice largely by myself. And that is my primary job. One of the other things that I do that you mentioned is I own a facility, a injury prevention and a rehabilitation return to sport facility in Ottawa, which is called Human 2.0. And I own that, and then I run that with my wife. And we've had that now. This is going on our 7th year, although I kind of say it's 5 and a little bit years because I don't count the 2 COVID years because that was a waste. So that got thrown out the window because we were shut down for almost 8 months out of the last 2 years. Or 8 months a year out of the last 2 years. So that's my second thing that I do. And then the third thing that I do is I have a relatively, reasonably large at this point social media following. Across a number of platforms, TikTok, Instagram, YouTube, and I create social media content to teach people about orthopedics, sports injuries, and about being healthier, being more active, being more fit, and how to prevent injuries. I try to either one, like any one of those things could be a full-time job. And if I was really, if I was smart and I was really dedicated to doing those jobs to the best of my ability, I would pick one of those things to do. But I'm also a very type A+ personality, and I always think I can do everything. So I'm wearing all of those hats. And I came up with the idea or with that hashtag and that name, Not Your Everyday Ortho, because when I first went through the orthopedic program, I wanted to be an academic orthopedic surgeon, and that was my goal. My things during residency didn't work out exactly the way that I thought they would. I struggled with that a little bit for a number of reasons. And so it didn't seem like being an academic was in the cards for me. But yet, prior to medicine, I was a teacher, a high school teacher. I had a teaching degree, and I I still had a love for teaching and a passion for teaching. So I thought, hey, you know what? I'm going to try to teach people, but it's going to be in a totally, non-linear manner, and not the way that people are accustomed to being taught. And so I'm going to start to do stuff. I'm going to try social media, and I was fortunate that I had several people that were close to me, two of my children, and some of their friends that were very prominent in social media and YouTube. And so I kind of got to see that from the inside, and I thought, hey, this is a tool I can use. So I thought that I would try that. And, after kind of doing that, running my facility, I thought to myself, I am not like my colleagues. I'm just different. I think differently. I do different things. And a lot of them, they think I'm crazy. When I opened up a facility, they were like, you need that, like you need a hole in the head. Why are you doing that? And likewise with YouTube, they think, oh, that's so stupid. Why would you be doing that? Why are you wasting your time? And so I just thought, hey, yeah, I'm not like them. And it's not that there's anything wrong with them. I don't think I'm better. I just think I'm different. And so I thought that Not Your Everyday Ortho was that moniker for the channel and what I was doing, because that's basically how I felt, but anyway, so those are the three hats that I'm wearing. And it proves to be very busy. Very, very busy.
Actually, that was going to be my follow-up question. I think one of the things I didn't mention here, and one of the reasons why I definitely wanted to talk to you were, you're one of the two surgeons, and me originally being from India, I see this kind of trend within not just doctors and surgeons, even physios, that in India, I always tell my patients too, it's like here in Canada, we have a great emphasis on sports and stuff like that. In India, the emphasis is, I call marathon studying as a sport. Like that's what we really do. We're not really engaged in a lot of activities. Cricket is big. And I was never into as much, but generally I find even physios, we had our heads kind of buried in the books and we were studying all the time. We didn't have a lot of emphasis on sports, and same was for doctors. So you're one of the two surgeons. Actually, one of the surgeon is from India. He's a pediatric surgeon, and I saw him the first time doing something similar to what you were doing once, which was working out right before the surgery. He was in the operating room and he was kind of working out, and it's that is so unique. So that's another thing I wanted to mention. In all the hats that you are wearing and juggling there, you also try to get in, you're always getting a workout in. I see you're playing with those maces or Indian clubs, and you're always putting out educational videos on how to move and stuff like that. So as you said, how do you get all that? Does it ever get too overwhelming? You have so much energy, it's so infectious.
So like I said, I'm a type A plus personality, and I am very busy. And I don't mean my schedule. I mean, I'm just a busy personality. I'm always doing something. If you speak to my wife, my kids, there's never a time where I am ever sitting around doing nothing. I'm either working or so. When you talked about the marathon studying, that resonates well with me, because I'm always marathon reading or researching something or doing something or trying to create something. I'm always busy doing stuff. And I remember as a child, my mother, before ADHD was a thing, right? Before that was an actual diagnosis, my mother used to say, oh geez, you would run around into walls and you just never stop. And so I'm always trying to do stuff. But in terms of energy, I'm always moving, I'm always doing something. And I just want to, I very much want to not only talk the talk, but I want to walk the walk. And because to me, let me recount a little story. So when I was doing my residency, I spent a lot of time on the spine service. And one of the guys that I trained under, who is retired now, this guy, he was a little bit of a gruff guy, okay? He was, a little bit short-tempered with the residents and stuff. But this man loved his patients, and he would do anything for his patients. And you know, as you know, spine surgery is not necessarily the most fulfilling orthopedic subspecialty, just because spine patients, they're usually pretty bad, and the outcomes are not necessarily good. Not because the surgery is poor, but it's just that by the time you actually need spine surgery, your spine is pretty jacked up. Like it's pretty bad. And so, you know, this guy, you know, really cared for his patients. But anyway, I remember distinctly one day in clinic, and we were looking at an MRI image, and he would always show the patients the image, and he would take time to explain to them. And he was showing them their back, and he was saying to the patient, you know, Mrs. X or Mr. X, you don't really need surgery, actually, because you can see here that the spinal column is okay. The facets are okay. There's no evidence of arthritis. There's no impingement of the nerve roots. And then he took them to a slide, and he said, but you see here are the muscles, and you see how the muscle on this MRI image is dark and the fat is yellow. Well, look at how much yellow there is in you know, combined with your muscle. He said there should be no fat there. It should be all one color. It should be all dark, right? And he was quite right. They didn't need surgery. They needed physio. They needed exercise. They needed to strengthen their back. And he said, you're out of shape, and you got to work, and you just got to be better. And the thing that I haven't told you about this man, he cared for his patients. But the thing that I didn't tell you is that he was over 300 pounds, and he was huge, overweight. And when he said to them, yeah, you're fat, you're out of shape. And I thought to myself in my head, inadvertently, I know he cares for his patients, but in my head, I thought, bro, do you even hear yourself? How can they take you seriously, right? How can they listen to you if you're saying that, and look what you look like, right? And so I've always thought to myself, I need to remain active. I need to you know, work out as much as I can. And to be honest, you know, I show stuff on social media. I grew up a gym rat. I was working out all the time in the gym. I played varsity football when I was in university, and I was fortunate enough to get drafted to the CFL. Didn't make it, but I was fortunate enough to be drafted. And so, all that time I was working out. When I was done with football, I continued to work out. I became a fitness trainer and an aerobics instructor, you know, and I did that for 10 years. And so I always thought to myself, I don't ever want to say to somebody, hey, yo, you need to work out, and then not look like I don't work out, right? And if I say to a patient, you need to do pull-ups, right? I don't want to show them a video of someone doing pull-ups. I say, hey, let's walk out of my office here to the gym, right? And I say to them, yeah, I'm 52, and you need to be able to do this, right? Or if I say you need to be able to do squats, single leg squats, then I'm not showing them a video. I'm gonna, in the office, I'm gonna go over to the side and say, you need to be able to do this. And if you can't do this, here are the progressions or the regressions that will allow you to get there, but that's what you should be shooting for. And so I'm always trying to be busy, because on my bio on Clubhouse and on Twitter, it says how I want to be a ninja. And it's kind of a joke. My wife said, you know, she put it, that's a little bit of an inside joke, but it is a joke, and it's not, because, you know, yeah, no, I can't be a ninja, but I can learn to do ninja shit. And you know, if I can be that strong and be that mobile and be able to have that kind of control of my body, then I think that's the goal. That's what I'm aspiring to. And I would like everybody to be able to aspire to that. So yeah, so I am quite busy, but I'm trying to, in whatever time I have available to me, I'm trying to recreate that. I don't always have time as much as I want, because if I had, if time were unlimited, I could do everything that I want, I would spend way more time working out. But as you said, I wear many hats, and there's only 24 hours in the day, and I don't get enough sleep. So
Absolutely. Yeah. And that's great. Like leading by example. That's one of the things I sometimes tell my patients when I see them and I want to suggest that they want to start working out. I often say that actually having a physical lab, for example, my job, like I was telling you, I was never into sports. I was a military brat actually. So I was like a jack of all trades, but I never played like university sports, but I did everything. So I always tell my patients when they're first starting to work out, and sometimes they'd ask me, it's like, don't you get tired like seeing so many patients? And I tell them, you know what, when I work out regularly, that energizes me to get through my day. So a lot of times I tell them that initially you may feel tired, like that may
yes,
happen for like a month or two or something, but then it starts to feed into that fire, which helps you get through the day a little bit. I don't know if you feel the same way like that.
for sure, for sure. And one thing that I want to touch on there, that you mentioned, is that I don't think enough of us as clinicians, whether it's physiotherapists, chiropractors, surgeons, whatever, sports med docs, I don't think enough of us as clinicians are honest with our patients, right? And what I mean by that is that they say, oh, you got to work out, and if you do this, it's gonna get better. But people just are ignorant, and they don't know, they don't understand how the body works and how long things take and how patient you need to be. And you just said, how people might be tired for the first month or two when they're doing these things. People think, because we're so used to everything coming instantaneously. I got my phone, bang, oh, it's right there. Oh, I'm going to do this next week, I'm going to be jacked. I'm going to do this, and next week I'm going to be in great shape. And it's not, my lungs aren't going to be burning when I'm on the treadmill or whatever. People have to understand that these things take time, man. And as you said, you might be tired for the first 2 months when you do it, but eventually it's going to energize you. And I'm always, as I said, I'm always trying to find more things to do. I'm trying to become more efficient with my day and my time. And I'm trying to pack more things in, without getting too philosophical or too religious. Let me just say that I grew up in a religious family, but now I would say that I am agnostic. Okay, so I'm not atheist because I cannot prove that there's not a God, but I don't know that I believe that there's a God, and I'm not necessarily sure that I see the significance of that. But having said that, my current philosophy, and this may change, I may learn something later on my life, but right now, my current philosophy is that I'm here for one ride, one time. Okay. I'm not going to be reincarnated. I don't know anything about an afterlife. I'm going to be here one time. There are so many things to experience in this world. There are so many places to go, so many people to see, so many things to do, and there's not enough time. And I'm 52 now, and people say that time goes more quickly as you age, and it's not that it goes more quickly. It's just that when you're young, you don't realize that time is passing by. You think you have forever, and you think you've seen it all. But as you get older, and you understand, you see, learn, and understand more about the world around you, then you realize how little you know, how little you've seen, and how much more there is to experience. And so I'm always thinking, geez, man, I got to do more stuff, because there's so much. Like, I think that I'm in an amusement park, and I want to go on every ride in the amusement park, man. That's what I want, right? And so I got to make sure I'm in shape to do that. I got to have the energy to do that. And it's like, where's the next ride, man? Let me see it.
Yeah. I love that. I wanted to talk to you. I wanted to give you a bit of just a little story of how I kind of found out about you and Human 2.0. There was a patient actually a couple of years ago when I used to practice as a physio in the US, and then I moved here. And when I was trying to get my Canadian license, I was working as a physio assistant in Riverside South. And I remember once a patient came in and he was telling me about your facility, so I had to go check it out, and that's how I saw your profile. And well, the rest is history. But what I found really interesting after I started following more and more of your stuff was I had a patient when I got my license, and it was so refreshing to see this. But I want to share this with anybody who doesn't know much about Dr. Raynor's practices. That the patient came in, and I was seeing my patient for post-op for knee replacement, and he brought in a physiotherapy script, which was so different from like the regular scripts that I often see from surgeons, and it was so refreshing. I can't remember it exactly from the top of my head, but as soon as I saw it, it was not generally, just to give a background to people who don't know, in North America, especially some of my listeners in India, in North America, I find that surgeons and doctors would probably mention what the surgery was or what part was affected or what the potential diagnosis was, and say physiotherapy for it. That's it. So it's basically 3 lines. But your referral was so different. It was a paragraph. When I started reading it, it said, patient requires active physiotherapy, which includes strengthening and stretching exercises, and minimum or no use of modality. The patient should be spending a cumulative of 1 hour in the gym or something like that. So it was something like on those lines. And when I saw it, it just brought a smile to my face. And then I saw your name there. And I told the patient, I was like, I know who that surgeon is, and I really like that. But it was so refreshing to see that, I wanted to ask you about, I've heard this before, but for some of the people who haven't, what made you write these scripts?
So when I trained in orthopedics here, so I trained in Ottawa, and then I did a fellowship in London at Western University. When I trained under orthopedic staff who did what you said, okay? So that's how I was taught. Knee replacement, right knee, physio, sign it, boom, send that off. That's what I saw for my entire residency, okay? So when I left after my fellowship and I started doing work for myself, I started my own independent practice. That's what I did, because that's what I saw and that's what I learned. Patients, so when you're in residency, you often see patients in consultation, and you see patients immediately post-op, but you don't necessarily see people long-term, because usually the staff people would save those patients for themselves. And then, if you're running a clinic together, they're seeing the long-term follow-ups, because it's just like, oh, hey, how are you, Abhijit? How are you doing? Yeah, the knee's okay. Yep, right. The learning really comes with the new patients, right? And the post-op patients. So I never got to see those long-term follow-ups. So when I started working for myself, I would do my physio requisitions exactly like how you mentioned, because that's how I was taught. And then I started paying attention to the results that people got. And when they came back, and I'd say, people would do okay. And then I'd say, well, if I thought somebody was running behind, they were, behind the average population of patients, I'd say, well, what were you doing for physio? And then they'd tell me, and then I just kind of make a mental note of it. So after a couple of years, I noticing, oh, well, geez, man, everybody who's stiff, they keep saying the same things. Well, we did some TENS, we did some ultrasound, we did this, that. And I'm saying, well, what about the exercise? What about this? And they say, oh, no, they gave me a sheet to take. They gave me things to take home, and I was supposed to do it at home. But that was difficult, so I couldn't do it. And they make whatever excuse. So then I was like, once you're the guy who is doing the surgery and you have to live with the results, and you go, well, geez, did I make any mistakes? I checked the x-rays. No, it's all good. I put everything in the way it's supposed to be put in. Why are we not getting good results? That's no good. Okay. So then I started to say to people, well, I don't like the fact that they're doing these modalities. I think you need to have more exercise, right? Because you'd say to people, are you doing the physio? Yes, I'm doing my physio. well, what are they doing? And they tell me. So then I'd start saying, okay, so physio, right knee replacement, patient needs exercise. And then I used to send that away. And the results improved a bit over time. They were improved a bit, but still not to what I thought they should be, or what I thought was possible. And I found that a lot of my colleagues, they would just give up and say, oh, well, oh, so and so Mark, he just had a stiff knee. Oh, it's just a bad result. And they would just go, and then they would wash their hands of it. And I'm like, man, that's no good. Like that doesn't fly for me. And those results are not good enough. I want better. So then I started being more specific and started writing those kinds of scripts. And concurrently at that same time, something that I used to do a lot of at the start of my career, I was doing insurance evaluations for motor vehicle accidents and workplace accidents. And so that's where, for people who don't know, that's where somebody has been treated for an extended period of time. They've not gotten any better. And so they send them to a specialist. In that particular case, it would be me. And I'm supposed to do an assessment to determine, you know, have they been treated appropriately? Like, what was their injuries? Have they been treated appropriately? Why have they not gotten any better? And then write a detailed report about that. So over the course of my career, I've done about 700 of those. And one of the things that most glaringly was obvious after doing all of those assessments, and keep in mind, I'm not treating those patients, I'm just doing a strict assessment. So I have no vested interest one way or the other, right? And this was before I opened up Human 2.0. So I was just paid to tell what was wrong and whether they were being treated appropriately. And it became very, very obvious after I was doing those that the people, most of the people, and not every single one, but I would say 85 to 90% of the people that were had poor results had inadequate physiotherapy, right? A lot of passive modalities and inadequate strengthening and flexibility work. So then that was happening at the same time. So it just, the light just kind of clicked. And then I was like, you know what? I made the assumption when I got out, I'm a surgeon, I'm in this silo, I cut people, hammer people, put them back together. Then I send people over to this silo, which is the therapy, physiotherapy silo. These guys have been trained, they know exactly what to do. I don't need to tell them what to do. They just do it and then it'll be good. But after seeing for an extended period of time that the results were poor, and then hearing about what people were doing, I'm like, well, I guess they've been trained in what to do, but I'm not sure that everybody knows what to do. So I'm going to give a specific recipe, a specific script for my patients. I don't care what you do with the rest of your people the rest of the time, but if you want me to send my patient to you for, you know, recovery after surgery, do this, right? And part of it was a little bit of a test because I wanted to see if I said that to somebody, are they going to do it, right? And because then I know if they don't do it, I'm not referring people to them anymore, right? But if they do it, then number one, I think they're doing the appropriate thing, and number two, then I go, okay, I know that's somebody I can refer to. So I just became more specific because I thought that was what was appropriate. I felt that physiotherapists, some physiotherapists need some guidance on what specifically should be done. And then the last, and when I did that, things got a bit better again, but still not enough to where I was happy. And so that's where Human 2.0 came about, because I was like, man, I need to run a business like I need a hole in my head. Like I don't need that. But if I'm not happy with the results I'm getting over here, I got to do it myself over here. So, and that's why I opened up a facility.
I see. And before we jump into like discussing a little bit about Human 2.0, I did mention this one thing. So what I found for my limited years of practice when I was in India was exactly the opposite. I mean, what was happening there was a lot of, I came from a school and the time, I guess, where my physiotherapy program was heavy modality based, but it was really what I would find was just what you said, result oriented, right? I didn't really care. I just wanted to see some results. And I would find that if I was just putting patients on TENS or just doing some modalities and giving them, then nobody was getting better, and it was as simple as that. I didn't have to like think about it. I was like, if I want to make a career in this, like my patients need to get better, as
Yes.
simple as that. And if they're not getting better with this, I need to seek something else. But what was interesting about what some of the surgeons mostly, and now this may have changed, this is just my experience from at least 10 years ago, what doctors and surgeons would do there was they would send a script which a lot of physios would really hate, but the script would be, the requisition would be very specific, almost specific like you, but exactly the opposite direction, where it was like, we want the patients to have ultrasound, TENS machines, and maybe a few exercises.
Well, so this is the thing. Like if you, this is a misconception that both patients and physicians have, that like that's the physiotherapy, that's what works. But yet, if you look on, do a literature review on PubMed, right, and look at the efficacy of TENS, ultrasound, all that shit, none of that works, man. It's good for addressing patients' pain symptoms. But listen, man, I'm not in the business of fixing pain. Like, it's not that I don't care about it. I do. But I'm in the business of fixing function, right? Getting people to be able to bend, to move, to lift. And generally speaking, when you address the function, the pain relief comes along, right? So stop chasing after the pain. And like I have so many physios, even still to this day, tell me, oh, I'm giving the patient some this and some that. And I'm like, okay, let's break this down to first principles. Okay. If I do a surgery or you become injured, there is a certain amount of muscle loss that is going to occur as a result of that. And I've heard estimates, although I haven't actually seen a literature source for this, but I've heard estimates that you lose muscle strength and mass at a rate of approximately 1% per day. Okay. And so if that just means, like, if you were immobilized for 2 weeks, that's 14%. Okay. Which means that there is a deficit that needs to be restored. Okay. And it's a deficit in strength. It is a deficit in muscle mass. And then anytime you're not using a muscle, it's going to become more stiff, right? It's just not going to maintain its elasticity during that time, largely because you're not using it. So we've established there is a strength deficit, there is a mass deficit, and there is a flexibility deficit. I challenge anyone to show me what ultrasound machine, what TENS machine, what any machine, laser, like whatever, is going to restore any of that, right? And so from my point of view, stop wasting your time. People don't have the money for us to waste their time, right? So they don't have the money for that, and people just frankly don't have the time for that, right? So stop wasting their time. Muscle flexibility and mass deficit, correct those things. And the way that works is by getting into the gym. And I credit my experience as a trainer and as a fitness instructor with having that knowledge. And I think that's the thing that allowed me to kind of put these two together and go, that's not rehab. This over here in the gym is rehab. And this is what we need, right? And I, as the surgeon, should be able to recognize that and then appropriately guide my patients and their therapists to understand that that's the path that they need to go down, right? And so it's our job to be able to lead them in that. And one of the things that I've been thinking recently, I now think that all musculoskeletal health professionals. So physios, chiros, athletic therapists, sports medicine physicians, physiatrists, and orthopedic surgeons. Those 6 specialties, I think that part of our certification should be that we all have to get our CSCS or our ASCM or ACSM or some personal training certification, so that people understand the basic concepts of strength training, periodization, you know, all of these kinds of things, right? So that people really understand where they fit in, where we fit in the spectrum of musculoskeletal care, and how those aspects of training are an integral part of the rehabilitation. And I don't think it, you know, I know a lot of my colleagues that just think, yeah, I do the surgery and then I hand it off to these people. But no, I think my job is to make people get better. And the surgery is like 5%, 10% of getting better, right? The rest comes with the rehabilitation and the guidance and all of that. So that's what I need to be. I don't necessarily need to have my hand in every single part of it, but I need to understand that my part is only a small part and that much of the work comes afterwards. And it's my responsibility as a surgeon to make at least sure that the patient is headed off on the right path, right? That I've laid out a path for them, that the first step of the path is the surgery, but then afterwards I've laid out a path that they need to follow, and it's headed in the right direction. So that you know, I think we need better education, but I also think you know, therapists, ancillary healthcare professionals, they also need a better education. And I think if everybody had that training, they all had a personal training certification, strength and conditioning certification, then people would realize TENS, ultrasounds, bullshit. It's like, that's not, it's window dressing, man. It's not effective, right? So let's do the stuff that works and stop wasting people's time.
And this is, I feel, such an important message coming from, say, a doctor or surgeon who, if you look at the, I guess, the hierarchy of healthcare, you guys are on top, like, right? You make the major decisions and then you send the patients, refer them down. So if that message comes from the doctor or the surgeon himself, then the trickle down effect is great, where like the patients know what's happening. Because sometimes we try to, so as you know, like a lot of physio, there's a change in trend in physio too, and it seems to be slowly moving in the right direction. But sometimes we'd say these things to our patients, but if they've had a past experience with, say, like maybe an old school physio or somebody who's been doing things the other way, that doesn't, or even the doctor, if they've said it, doesn't sit well. So if you have the, like, say, the doctor on your side where he's saying the same message what you believe in, I think that really helps with, like, you know, the patient compliance with exercises and, you know, overall success of the program itself.
Well, and that's part of the reason why, also why I want to be able to do this stuff myself, do the activities, because, you know, I myself, I've had several knee surgeries. I've had my knees injured during football and sports and that kind of thing. And after I injured myself, I've never done like regular physiotherapy. I think maybe for the first one I did. After that, I rehabbed myself. And one of the things that I like to say to patients, because not every patient knows that I have had multiple knee surgeries. And, you know, patients, you know, will say, hey, oh, this hurts and my knee is stiff and it's difficult for me to do this, blah, blah, blah. And I'm saying, yeah, you know what? I know what you're talking about because I've been there. I've been there 5 times. And here, this is what I can do today, right? And I think that that shows people that it shows them the strength of what I'm saying, right? So it's not only that I'm as a surgeon, I'm saying you should do this. I'm saying this as a patient, past patient, you should do this. And oh, by the way, did I mention, if you do this, then you can do this over here that I do, right? And usually when I say it to them like that, I'll drop down and I'll do a pistol squat, like just in my clinic clothes, cold, and I'll just do a pistol. And they'll be like,
That'll light them up.
yeah. And I'm like, yeah, 5 knee surgeries. There you go. What are you complaining about? Let's get at it.
Amazing. Yep. And this is a perfect segue to talk about, I guess, your facility, which almost does all of those things and more. So I know Human 2.0 is like you described, there's physio and rehab going on there, but it is a unique facility in terms of there are other things as well. Could you go over like some of the other stuff apart from rehab that goes in there as well?
Yeah, certainly. So I run my office out of there. So I have an orthopedic office, and I now have 2 sports medicine physicians that also work out of there. We do physiotherapy, so rehabilitation services, physical therapy there. We have a massage therapist, one presently who's working with us. And then we also have fitness training. And, you know, our fitness training is sort of injury prevention based. And its focus is on mobility, body awareness, and body control. So we do strength training. We do Olympic barbell lifting, and we do a ton of stuff with kettlebells. But we have a strong orientation towards developing mobility. And the way that we use that word, because mobility means different things to different people. But the way that we use that word, mobility is the place where strength and flexibility interconnect with one another. Okay, and mobility is a way to express athleticism. And you have, say, for example, you have strength athletes, bodybuilders, power lifters, that kind of stuff, and they are very strong, but quite frequently they're not as flexible. Then you have somebody like, say, a contortionist or whatever, who's very, very flexible, but not necessarily very strong. We want to train people how to maximize their range of motion of any given joint, and then train them how to develop strength, not at one point in the range of motion, but throughout the range of motion, so that we can improve their ability to express themselves in a physically literate manner, improve their ability to protect themselves by increasing their body's tolerance for stress in a number of positions, and that's sort of where our fitness is focused. So we have the fitness side. We also do team training. So when the Red Blacks first came to Ottawa, quite a large number of the team at that time, most of those guys have gone elsewhere now or have retired, but they came to our gym, and we were doing mobility work with them, because they did a lot of strength, bigger, faster, stronger. They did a lot of that already at the gym. And what they're trying to do is what are the things that will give my career longevity? And so that's where we sort of cross the bridge between the strength and conditioning training to mobility training. So we do team training. We've dabbled a little bit with tactical training. So we've been, prior to COVID, we were training the tactical paramedics for Ottawa, doing all of their fitness stuff. And we've kind of done a little bit of stuff and talked to a little bit about some of the other local tactical groups. So RCMP Tactical, Ontario or Ottawa Police Services Tactical. And at one point we had 2 JTF Special Forces guys that were training with us. So we've done a little bit of that. And then the last thing that we do is corporate education. So where we give seminars. Previously, they were all in person, but for the last 2 years, because of COVID, we've been doing that. They've been virtual, but we're giving seminars where we talk to businesses about how to increase productivity in the workplace through decreasing injury, right? And keeping their workers, making them more resilient, making them more resistant to injury, so that they can continue to do what they're doing and use less sick time. So those are kind of the things that we do out of the facility, Human 2.0 facility.
And one of the things that I kind of made a note of, and I heard you discuss this on a separate podcast, and I thought it was really interesting to mention this here, was for any physiotherapist or any healthcare practitioner who's in the trenches and who's working, and sometimes when you're trying to have that multidisciplinary approach where you're trying to collaborate with other practitioners, we all know how hard it is to be able to communicate with, say, the patient's doctor or even the surgeon. Like the doctor is hard, the surgeon is even harder. So one of the things that I do in my office is I'm writing these little scripts for the doctor every time, or little updates for the doctor every time I send them. Some of them read it. Oftentimes when my patients go see them come back, they're like, well, there was no mention of that at all. And sometimes that can be a bit frustrating. But for anybody who's been in that situation, I know you mentioned this on a different podcast, and it's such a game changer where if me as a physio, if I have a question and I'm working with one of your patients and I see you right there, and I know like in your office, the communication is fairly seamless, right? It's such a bonus to have.
Oh, for sure. And that's part of when people come into our facility, they go, oh my God, like it looks like a CrossFit gym, right? Because it's meant to, I said to the architect when we designed it, said, I want people to understand this is a place of work, right? Like I want it to look good because it's obviously an orthopedic surgeon owns it. I don't want it to look like a dungeon. I'm happy to work in a dungeon. I'm cool with that myself personally. But as a medical professional, for my patients, they're not all necessarily going to feel that way. So it needs to look good, but I want it to look like it's a place of work. But also important in the design is that I want people to understand that there are no walls and there are no partitions between training space, rehab space, education space, everything, it's all together. And so I try to create an environment where that was part of the way that just the design of the space allowed us to give people that message that we were all collaborating and that all of these things work together seamlessly. Whether, like I'd say to people, we take you from your injury to your surgery through to your rehabilitation to wellness and beyond, right? Because we're not trying to just rehab you after your ACL. No, I'm trying to make you into a ninja. I'm trying to make you into a superhero. So we're trying to take it to the next level. And so it was very important that we give people that idea of seamless integration, and the communication, as you mentioned, is a fundamental part of that. It's great that anytime my physio has a question about a patient, they can just, hey, yo, Chris, can you just come out here and check this? No problem. And I do that, right? And interestingly enough, people might look at it and they go, oh, this is crazy what you're doing, or why would you do it this way? I have my physios, this works, and it works for our patients, but it works for other people's patients as well. And they sometimes they have no idea, because not everybody that comes to our facility is my patient. There are lots of patients that have been treated by other surgeons, and then they come to us for rehab. And when they're there, my colleagues, my therapists might have a question about this procedure or whatever. And they go, oh, Chris, can you come out for a second? Now, I'm coming out to look at somebody who's not my patient, right? But because I know the person who's done the surgery, I know what they do because I trained with them or whatever, I can say, oh, yeah, that's so-and-so. They do it this way. This is what they'd like. And this is what I think you should do, right? Where else and in what other type of arrangement are you going to be able to have something like that? It's not going to happen. You know what I mean? Because they would have that question. They wouldn't be able to call the surgeon directly. They would have to write it down on a note like you. The patient would have to take it back on their next appointment, whenever that is, to the surgeon. The surgeon, if they read it, would have to read it, write a response, then bring it back to you, which could take 3 weeks, right? 4 weeks, a month. Whereas they can ask me, they have the answer immediately. Change what they're doing in response to the answer that I gave them immediately and make a difference today instead of a month ago, right? Like, to me, that just